This is part 1 of our America in Crisis series, and today we're breaking down the sharp rise in US flu cases and why public health experts are sounding the alarm. Parts 2 and 3 are coming soon. If you want clear analysis of the biggest US stories, hit that subscribe button now and turn on notifications. The United States is experiencing a rapid and surprising surge in influenza activity, according to the latest data from the Centers for Disease Control and Prevention, CDC. Officials estimate that at least 7.5 million Americans have already fallen ill with the flu this season, including 81,000 hospitalizations and around 3,100 deaths. At least 8 children have died from influenza so far. AP News. Health authorities report that flu activity is very high or high in many states, and the rise has coincided with winter travel and holiday gatherings, conditions ideal for respiratory illnesses to spread. So why is flu activity spiking so sharply this year? One major factor is a new dominant strain of influenza A known as H3N2 subclade K. This variant is spreading faster than typical strains and has been linked to significant outbreaks in other countries like the UK, Canada, and Japan earlier this season. Time. Although this new variant isn't considered inherently more deadly than other strains, it has infected large numbers of people in a short time, partly because fewer Americans got a flu shot this year compared with past seasons, meaning community immunity is relatively low. AP News. Public health experts are now warning that the flu season may not yet have peaked, and cases could continue rising through January and even into February. The surge isn't just a number, it's hitting hospitals and clinics hard. Hospitals in multiple states are reporting increased emergency visits for flu and flu-related complications. In some regions, hospitalizations have nearly doubled in just a week, stretching already busy healthcare systems. Reddit. For many Americans, especially older adults, young children, people with weakened immune systems, and those with chronic illnesses, influenza can lead to serious complications like pneumonia and respiratory failure. AP News. Doctors are reminding people that flu isn't just a bad cold. It sends tens of thousands of Americans to the hospital every year, and this season's numbers are already well above the typical baseline. With all this rising illness, what can you do? First, get vaccinated if you haven't already. The CDC continues to recommend flu vaccination for everyone 6 months and older, even late in the season, because it still offers significant protection against severe disease and hospitalization. AP News. Vaccines may not perfectly match every strain, but they greatly reduce the risk of serious outcomes, especially in high-risk groups like seniors or people with underlying health problems. Public health experts also recommend frequent hand washing, staying home when sick, covering coughs and sneezes, and avoiding close contact with vulnerable people. These common sense measures help slow the spread of influenza and protect your community. This flu spike is a reminder that infectious diseases still pose a major threat in the United States, even years after COVID-19. It also highlights challenges in vaccination coverage and public awareness, problems that can lead to avoidable hospitalizations and deaths. AP News. As the season progresses, health officials warn that hospital systems may face additional strain alongside other respiratory viruses like RSV and COVID-19, especially during the busiest winter months. Thanks for watching part 1 of our America in Crisis series, where we break down the stories shaping your world. Part 2 drops tomorrow, where we'll explore the US military strike and rising geopolitical tension in Latin America. Make sure to subscribe, hit the bell, and like this video to support independent news analysis you won't find anywhere else. Comment below. Have you or someone you know been affected by this flu season? Let's talk.